This was supposed to be the first meeting in 26 years I wasn't supposed to be speaking. Chris? Oh my goodness. Darell and I have been reliving a lot of very special past moments during the afternoon and prior to this evening, and how we dragged him in. It was a great story. But Darell really helped us dramatically in getting our research program off the ground and establishing our Scientific Advisory Council, which even today still reviews grant applications and helped guide the board of directors in the right direction to make sure that whatever research we were funding was research that would be leveraged in the best possible way in forwarding the field of brain tumor research. So there are just no words, Darell, adequate to thank you for your years and years and years of dedication. I think we honored you more than a decade ago for 15 years of your leadership of the Scientific Advisory Council. Interestingly, when Darell stepped down, David stepped up to take over for him. And listening today to your remarkable research that is ongoing and your contributions to the field over so many years, and for all of the amazing current and future leaders that you've also trained. We're just all so indebted and so appreciative of your dedication to our cause. Thank you.
You know, the award should really go to Bonnie. You know, there's no one that I have any more respect for. I don't know how many of you know all of Bonnie's personal situation. I certainly won't get into it, but to see the strength of character and the forbearance that she's had to deal with these things, and yet still be here tonight trying to give back to others. Such a wonderful person, Bonnie. And David, thank you for that introduction. When I hear something like that, I always wish my parents were still alive and here, because my father would have been proud, and my mother would have actually believed all of that. But so I won't. It's late, and I won't keep you much longer tonight. First, I want to echo your remarks. When I was the chair of the Scientific Advisory Committee here reviewing grants, and the many other situations I've been in at the National Institutes of Health, and David and I have done a lot of this over our careers, I didn't play by the rules. I believed in funding people and not projects. If you fund people, the projects are going to follow, and you do have to perhaps wait a little bit to see whether the person really deserves to be supported like that. But some of the things I'm going to show you in just a moment came out of my funding people that I was able to in my organization. And I really wish Harold Varmus, the current director of the National Cancer Institute, has adapted that philosophy in part. He's now resurrected one of the older funding mechanisms called the Outstanding Investigator Award, and he's going to fund 50 of them this year, in which he'll give $600,000 a year for 7 years, much more and much longer than the average NIH grant, to individuals. And the thought is to let them use their creativity to move the field forward. And I hope we can begin to do that more and more, and I truly agree with you. So let me tell you a little bit of the history of going back with Bonnie and Sid. They had a child at Duke, and my colleague Henry Friedman had gotten to know them. And Bonnie and Henry wound up somehow at 2 o'clock in the morning over in Henry's kitchen, I think eating Oreo cookies and drinking milk. And the question arose about how to really distribute the funds that they were beginning to raise, or in many cases giving personally, for the early parts of the Brain Tumor Society. So the next day, or a few days afterward, I remember very clearly, and I think this was 23 years ago, Bonnie and Sid were in my office, and we discussed how the best way to do things was. And I suggested that we identify the best scientists that we could and set up a peer review mechanism, which we did. For many years, I guess possibly as many as 15, we had conference calls with that group of people and reviewed those grants. Bonnie and Sid always were participants in the call, and we always had in-depth discussions afterwards. And I believe we truly did select the best people for those awards. And then I've always felt that there came a time when you really passed your peak, and that things should be handed on. And I was so glad that David was willing to take over those things. But you've had enormous impact, and I'm sure you must wonder sometimes when you hear these things from Big Pharma that it costs hundreds of millions of dollars to bring a new treatment all the way through to FDA approval. How on earth could these relatively small amounts of money compared to that make a difference? And the reason they make a difference is some of the things that we heard discussed earlier. When David and I were first starting out doing research, if you were at an institution like Harvard, or the Harvard of the South, as we sometimes call Duke, if you were at a good institution and you had a good idea, all that you had to do was send your application up there, and it got funded. But the young people today are facing a totally different situation. You heard the numbers. 1 out of 10, or less than 1 out of 10 of their grants get funded. And not only that, they have to have finished at least a third, and sometimes 40 or even 50% of the work. And where on earth is that money going to come from? And this is where the type of funds that you raise have such an impact on the next generation and the young people coming along. Also, I think you're going to make a big impact on this defeat glioblastoma effort. I do hope, and I said this today in this meeting, that the current movement going forward will embrace the area that I've worked in for so many years, in which there have been so few people in the brain tumor field working, and that is immunological approaches. Big Pharma now has finally recognized that that is going to be the wave of the future. And although there are going to be individual cases and some impact of these small kinase inhibitors, signal transduction inhibitors, I truly believe that there needs to be more than that, and that these immunological approaches, I hope, will be embraced by your foundation in the future. So let me show you, I promise not to show a bunch of science for you, but I do want to show you 3 slides, if I could have the first one up there. So this is a scientific slide, but it carries a story. And first of all, the most important story is you see this curve here. This is 80 months out. And we believe that these patients, and there are not but a few of them, but that they are very likely cured of glioblastoma. I never have been willing to use the cure word until the last few years. But not only is that happening, but the overall survival is being doubled above what can be had with standard of care treatment alone. But what agonizes me about this is that we did the study that formed the basis of this science in 1990. And what we were doing was taking this piece of protein that Dr. Vogelstein's group at Johns Hopkins and I had discovered, and we were immunizing animals just to make a diagnostic reagent that David and I could use to detect this specific protein in the brain tumor slides. And it never crossed my mind that this could be used as treatment. It shows you how we can get bogged down in silos and not thinking beyond where we should. And it took almost 10 years before one of the students came in and said, "Don't you think this might have a result in treatment?" And I said, "Oh, you're nuts. But let's go ahead and try it." And lo and behold, this is now in what we call phase 3 randomized trial. And we believe this is going to be one of the first, one of the new treatments approved for glioblastoma in the last 25 years. And we should hear from it in another few months. Now this, so that's a form of immunotherapy. And this is another one. And this is an example of another person that I bet on. I fell into the job that I quickly got out of as the interim director of our cancer center at Duke as quickly as I could. But during the time that I was in that position, I was able to recruit some outstanding young scientists. And there was a young German who got his MD at the University of Hamburg and decided he didn't want to do clinical medicine. And so he came to upstate New York to work with one of the last poliovirus groups. Nobody works on poliovirus much any longer because we got a vaccine for it. But when he got there, he got to thinking about how on earth we could harness the ability of poliovirus to kill tumor cells. This virus is one of the most efficient cell-killing machines that there ever has been. And so what he decided to do, I'm going forward, how do I go backwards with this? There we go. What he decided to do, if you see the little pink portion right here, was to use modern gene cloning methodology and clone that piece of the poliovirus gene out, and he replaced it with the gene piece, the same gene piece, from the ordinary cold virus. And what this does is it destroys the ability of that virus to kill nerve cells and cause polio. Doesn't cause polio at all anymore. The FDA didn't believe it. They made us actually put the virus in the brains of 38 monkeys and show that there was no possible way that it was going to cause some sort of strange polio epidemic or what have you. And so I bet on this young man, and I recruited him to Duke, and he was actually denied tenure by his basic science department because they felt his work was too clinical. So I got with the chairman of neurosurgery, and he and I put up the funds to give this young man tenure. And here is the clinical trial now that he's leading with me. We don't usually show faces of patients, but this young woman, Stephanie, was written up in People magazine, and she's given us written permission to tell her story. She was the first person with a recurrent glioblastoma, and recurrent glioblastoma patients don't usually live but 6 or 8 months after the recurrence. But she decided that she was willing to be the first person ever to let this modified poliovirus be put into her brain tumor. And you probably can't see all that well, but here was where the tumor was when it recurred. And now, I believe about 30 months later, there's nothing left in her brain but a little bit of scarring. She's clinically normal. She's not on any other treatment. Again, I'm very reluctant to use the cure word because we don't know how long we have to follow these patients to know that they're cured. But she's got the best result that I've ever seen in treating recurrent glioblastoma. Now, what this virus does is when it goes in, it kills the tumor cells. But more importantly, it sets up what we call a secondary immune response. So we really refer to this as another type of immunotherapy because what it does is mobilize Stephanie's immune system to go in and finish all the rest of the cells off. We know that, and David can tell you, if you looked at her brain, if we had the chance, which I hope we never will get, to look at her brain, there would be tumor cells that have been on both sides of the brain and possibly even down in the spinal cord. But this secondary immune response, we believe, destroyed all of those cells out there. And now that Big Pharma has discovered some of the things that we knew as long as 25 or 30 years ago, they've now come up with other compounds that will stop the immune suppression that these tumors are doing to the body's immune system. And we believe that we'll even have a threefold mechanism to go after these cancers. So I'm more optimistic than I've been in a 50-year career. I do believe that within the next 10 years, your goal is going to be reached, that we're going to be more than doubling median survival, that we're going to see a significant number of people that we can say without any doubt are cured. And it's the support that you have given the research community has made a difference and will continue to make a huge difference in this battle. So thank you all very much. We appreciate what you do.